welcome to Intro to Mindfulness-Based Cognitive Therapy. I'm Tracy Ochester. I'm a psychologist in private practice here in Kansas City, and I'm also the Heart-Mind Coordinator for the Midwest Alliance for Mindfulness. And today I'm going to tell you a little bit about mindfulness-based cognitive therapy, which usually we just shorten it to MBCT. I'm grateful you're all here. And I think the best way to understand mindfulness is to practice it. So I'm going to start us off right away with a practice. And I think that before you launch into a practice, especially if you're a little new to it, I think it's good to have a little bit of knowledge before you launch in about how to bring yourself into the present moment. If you're feeling overwhelmed by a practice or scattered, or if you're having any kind of feelings of distress, know that you can listen to your own inner wisdom and you can modify a practice any way you need to, or discontinue a practice. You can do your own practice. Maybe you have your own sort of resources that you use to anchor yourself. But some suggestions I have for you are to pick a sensory experience that is relatively calming or at least neutral for you. We're going to do a little exploration of the senses, so you'll be able to try them on and see if any of them feel a little more grounding than the others. You can also expand your awareness out so that you're including more of your surroundings. Sometimes that kind of lessens the intensity rather than being single pointedly focused on something. You can take in the good, so you can connect in with your good intentions, or you can bring to mind something that makes you happy or that you feel grateful for. That can help ground you. You can practice opening and closing. So sometimes you might want to close off from a practice and draw inward. And then you can open up again when you feel ready. When you're feeling grounded, you can open up again and return to the practice. And you can do some self-compassion. So you can send yourself some words of loving kindness or use some compassionate touch. And finally, you can always just change your posture. You can open your eyes. You can stand up and move around a little bit. Whatever it is you need to do to make the practice work for you. So for this first practice, I invite you to find a posture that helps you feel supported and allows you to remain relatively alert. And perhaps beginning by just doing a kind of a broad scan of your inner experience, just seeing what the internal weather patterns are like today. And knowing that this practice is a little bit of an experiment. So you're welcome to explore, maybe invite in some curiosity or playfulness, and adjust the practice as needed. We'll start with the sense of sight. You can do this with eyes open or closed. Beginning to allow visual sensations to fill awareness. So this might be awareness of light or color, shapes or movement. Opening to visual data as it arises. And on an exhale, letting The sense of vision begin to fade into the background as you open to awareness of sounds, not so much seeking for sounds, but just being available for them as they occur. And noticing the quality of sounds, volume, pitch, whether they're constant or intermittent. And being aware as they arise, sustain for a little while, and perhaps pass away. And then allowing sounds to fade into the background of awareness as you open to the sense of taste. Noticing if there are any flavors present, and if not, just simply noticing the absence of flavor, being fully aware of taste. And on an exhale, letting taste move to the background. As on an inhale, you become aware of aromas. Are there any smells to be found? Maybe just the familiar smell of your space. Or there may be no discernible aromas, and that's okay too. Just being aware of the absence of smell. And finally, we'll move to the sense of touch. So, noticing any sensations on the skin, maybe a sense of temperature, of light pressure where you're being supported, maybe even a sense of subtle movement of the air around you. And finally, releasing your awareness to touch and beginning to expand your awareness to include any sensations that arise, allowing in sounds, physical sensations of touch, maybe beginning to blink open your eyes if they're closed and letting in more visual stimuli, and transitioning from the inner world of sensory experience to the outer world of this workshop and Zoom room. So we did a sensory anchor practice where you had a chance to explore different senses, noticing what it was like to be seeing and hearing, smelling, tasting, and touching. And hopefully you noticed that perhaps you moved away from autopilot, that kind of automatic way we tend to move around in the world, and became more present, became more aware of what was happening moment by moment. And also, you were practicing directing your attention from one place to another, moving your attention around intentionally to where you'd like it to go. There might have been some things that you noticed that you hadn't noticed before, or some things that you might have noticed in more detail. And also, you probably noticed that the mind wandered, maybe just a little or maybe quite a bit. And that's something that we are not often aware of when we're on autopilot, just how much the mind is active. It's a very human trait. And part of learning how to practice mindfulness is kind of accepting the wandering mind, maybe even having a sense of humor about it, and learning how to redirect it gently and kindly as needed. I like to define mindfulness because there's so many different definitions and lots of different ways people look at it. This definition on the screen is the one that we created with the Midwest Alliance for Mindfulness. All the teachers contributed to make this definition. And it says mindfulness is a way of living developed through a variety of practices that helps us bring kind and non-judgmental attention to moment by moment experience, giving us the choice to respond in ways that support health and well-being for ourselves and for our communities. So mindfulness is this innate ability, we all have it, but we can cultivate it and train it through practice, or even what some people might call mind training. You might have heard Jon Kabat-Zinn's famous definition of mindfulness. He says, mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And this particular way is pretty important. It's a pretty important piece of practicing. The how that we practice mindfulness is just as important, if not even maybe more important than the what exactly we're practicing. And so we learn to adopt certain attitudes. You may have heard me say some things about that during the practice, about being kind and gentle, having some curiosity. All of these kinds of attitudes are helpful and supportive of cultivating a practice of mindfulness. And we're learning to pay attention without being overly attached to our experience, and also without being overly reactive to our experience. So there have been a number, thousands of studies now on mindfulness, and what the research consensus is that the practice of mindfulness is correlated with increased attentional control, decreased reactivity, improved working memory, and greater kindness. Also, it's correlated with greater acceptance and tolerance of discomfort, as well as decreased avoidance and suppression of difficult challenges. Emotion regulation is improved. Physiological arousal, having our nervous systems super activated, that's decreased. And we tend to be more open. We have a greater willingness to contact our experience. And there's greater cognitive flexibility among practitioners. We're also finding some pretty exciting health benefits. We know that the practicing mindfulness tends to elicit a relaxation response. So our parasympathetic nervous system, the rest and digest part of our nervous system, is activated. And then there are changes in metabolism, heart rate, respiration, blood pressure, brain chemistry. All of these things help us have a more relaxed state so that we can access our higher thinking rather than being stuck in a fight or flight mode. Also, studies have shown that EEG activity is slowed, especially the activity that's related to the fight or flight nervous system. And there are also changes in genes related to inflammation and histones There's decreased oxidative stress and increased hormones that protect our telomeres, which are part of our DNA related to aging. This screen shows some of the attitudes that we're cultivating as we practice, the how of practice. And interestingly, practicing mindfulness tends to cultivate these attitudes, but also purposefully cultivating these attitudes helps us with our mindfulness practice. And these are things like trust, learning to trust your own experience, learning to be able to be with whatever arises, non-judging, being able to be more of an impartial witness rather than a harsh critic of your inner experience, and also allowing experience to unfold and not prematurely deciding before you have all the information. Non-striving, a lot of times we want to get things right, we want to do things perfectly, and that can really cause us quite a bit of stress and get in the way, we can get in our own way. We're learning how to be patient and allow things to unfold. Taking a beginner's mind. Some of us have been on the planet for a while and we know some things, and it can be hard for us to step back and see things with fresh eyes, to open to the possibility of new learning. And compassion is a really important one. Being able to have a sense of kindness and caring for ourselves and other people as well. All of these attitudes are useful in the practice of mindfulness. So MBCT has a cognitive behavioral component to it. It has the mindfulness part and the CBT part. CBT stands for cognitive behavioral therapy. And this little graphic that you see is the cognitive model, and it shows that our thoughts, feelings, and actions are all interacting. They influence each other, and this influences the way we feel in a situation. Cognitive behavior therapy was an exciting, revolutionary approach back in the 80s and 90s, and it arose out of the early behaviorism of the 1920s and the theories of cognition of the 1960s. And this is where we began to realize that many mental illnesses had a component of behavior involved, in which we had this kind of conditioned response to certain stimuli that created suffering, and that our thoughts and feelings and beliefs also fed into this cycle, sometimes can be a harmful cycle that occurs. CBT tends to be very problem focused and action oriented. And so many of the exercises and strategies that we use in MBCT come out of the CBT field. So what does mindfulness add to the equation? Well, I have this little chart here that kind of shows highlights of CBT on one side and highlights of mindfulness on the other side. So while CBT tends to be problem focused, mindfulness tends to emphasize being non-judgmental. CBT tends to be a little more directive, offering homework and exercises, whereas mindfulness tends to be more cooperative and exploratory. CBT is time limited. Usually you get something like 8 to 16 sessions, whereas mindfulness is viewed as a lifelong practice. Problem solving and learning new skills is highlighted in CBT. And in mindfulness, we emphasize being over doing. In CBT, the goal is to change thinking and behavior to reduce suffering. And in mindfulness is to change your relationship to thinking and behavior to reduce suffering. But both are very present moment focused and encourage us to begin to get to know our inner world and to observe our experience with curiosity rather than avoidance. So what is MBCT? It combines mindfulness and CBT, and it's designed to prevent the relapse of depression. It's especially useful for people who have had many episodes of depression. And it's especially useful for people who have had severe depression in the past. It helps us interrupt the downward spiral that tends to occur when we're entering a depressive episode. And it reduces our reactivity to some of the usual things that occur in the beginning of a depressive episode. It allows us to find a pause, to make space for choice. And we begin to learn how to step back from our thoughts and feelings and take them less personally, so that we can have a little space to make some decisions around how we'd like to respond. It gives us a chance to respond in a helpful way. So depressive episodes often happen because there are these sort of recurring behavior patterns that emerge. It can start with certain triggers that may result in ways of thinking and ways of behaving that create a downward spiral. But then after the first episode, then we begin to be afraid that we're going to have another episode. So then we get a little vigilant to it, and lots of other kinds of triggers may start the spiral happening. And so we become vulnerable to additional episodes of depression. MBCT helps us spot that before it gets too severe, too intense, so that we can start to implement strategies to help us move through before it begins to take over. So there are lots of great studies. It's interesting. I was in, I believe, the third cohort of folks here in the United States, I believe, to be trained outside of academia to teach MBCT. And it's been really great to watch all these new studies coming out supporting its efficacy. It's especially helpful with patients with 3 or more previous depressive episodes. And it's similar to maintenance antidepressants. And it's superior to antidepressants in residual symptoms that last, and also quality of life ratings. But it's also can be very useful to use antidepressants and take MBCT at the same time. If somebody's using antidepressants and it's helpful for them, you can continue to use them and take MBCT. So rates of relapse did not differ between MBCT participants who continued to take antidepressants and those who did not, which is kind of interesting. And patients have now been followed 2 years post-course, and improvements have been sustained after taking the course. MBCT is recognized by the American Psychological Association's Division 12 as an empirically supported treatment with strong support for its efficacy. It's also listed in the US Substance Abuse and Mental Health Services Administration's National Registry of Evidence-Based Programs and Practices. And it's been endorsed by the American Psychiatric Association as an effective treatment for the prevention of relapse in individuals with 3 or more episodes of major depression. And finally, NICE, the National Institute of Health and Clinical Excellence, endorsed MBCT as an effective means for prevention of relapse and recurrence of unipolar depression since 2004. So it's a first line of treatment for those using the National Health Service. So let's try another very brief practice. So once again, seeing if you can find a posture that helps you feel upright and alert, reasonably comfortable. And letting the body express a sense of being present and awake. And you can either close down your eyes or just find a soft gaze somewhere out in front of you. And we'll take a first step of just becoming aware of what's going on with you right now inside, what's going through your mind, what thoughts are around. Just noting thoughts as mental events. And then noting if there are any feelings present. Maybe turning toward any sense of discomfort. Maybe there are some pleasant feelings here. If there's any challenging sensations, maybe saying to them, ah, there you are. This is how it is right now. If there are any sensations in the body that are making themselves known, maybe any tension or holding, just becoming aware of them. Just simply notice whatever is arising. And having touched into a sense of what's going on right now, having stepped out of autopilot, the second step is to collect your awareness by focusing on a single point. It might be the movement of the breath in the body or some other sensory experience. And following it as best you can, moment by moment. Noticing the arising and the sustaining and the changing. And now, on the third and final step of this practice, allowing your awareness to expand once again to the entirety of your experience, your body, mental events, the breath, seeing if you can bring attention to the entire length and breadth of the body from head to toe. And just holding your awareness in this more spacious, expanded place until we release the practice. And when you're ready, beginning to transition out of the practice, perhaps by beginning to blink open the eyes or make small movements of the body. It might be nice to stretch or to take a sip of your beverage. And we'll return to the Zoom room and this workshop. So, if you focused on the breath during the second step of the practice, we would call this the breathing space. But for some people, the breath is not a comfortable place for them to to anchor their awareness. And so in that case, you may have chosen another sensory experience. This is a really brief portable practice that's one of the hallmarks of the MBCT program. It allows you to use the breath and body as an object of focus and to reconnect with mindful presence. So you can do this anywhere you are. Maybe you just pulled into the parking lot, parked the car, you're about to walk into a new place. You can take a 3-minute breathing space, three segment breathing space to gather and settle your mind, to check in, and then to move into a new experience with kind of fresh awareness. This practice also allows you to step back a little bit from thoughts and feelings and to observe them as mental phenomena rather than getting caught up in the storyline of them. And we do a lot of practices in MBCT to help you learn how to do that, to decenter from your thoughts and feelings so that you can gather information about them more objectively and have space for choice. The MBCT course is 8 weekly 2-hour classes. There are before and after measures for you to fill out. There's a workbook with handouts. We just do that electronically now. There are mindfulness and CBT practices and exercises that we do in the meetings, but also you're asked to practice them outside of the meetings. You're asked to do about 45 minutes of daily homework. The homework is really just practicing what we learned in the meeting. So there's not, reading or writing assignments, things like that. And as you move through the course, it's possible to break those 45 minutes up into different parts of your day. The beginning practices are a little longer as we're getting established. But as we go through the course, you begin to choose your own practices, and that may allow you to have some flexibility in the time that you use for your homework. And then each day that we come to class, we review the homework, talk about any challenges people may have had or any insights they may have experienced. And we do some practices and what we call inquiry. So just exploring what you discovered in the practice, what you encountered. And then there's also a half-day silent retreat, usually on a Saturday from like 9 to 1, where we try some different kinds of practices and you get a chance to see what it's like to have a longer period of practice. I wanted to mention that there's more and more research indicating that MBCT is also quite useful for anxiety disorders. And you can imagine why, after some of the things that we already talked about, that mindfulness is useful for. First of all, it creates a relaxation response that allows your central nervous system to be calmed so you can see things through a wider lens and think about things more flexibly. When we're in fear, our lens narrows and gets very rigid. And so then our responses tend to be rigid. We go back to our default, we go back to what we know. It's harder for us to be creative. And mindfulness helps us break out of these cycles of sort of fear-based responses that can send us in a negative spiral. Also, mindfulness can act as a sort of exposure therapy, a kind and gentle exposure therapy, because you're learning how to be with whatever arises and resource yourself around that so that you're better able to experience distressing thoughts and emotions with a compassionate and accepting attitude rather than feeling like you always have to fight against them, push against them, try to get away from them. Sometimes there are things that we just can't change, and being able to be with those things can be very useful. Research is showing us that there is a strong connection between mindfulness and compassion. Consistently finding over the past 2 decades that mindfulness increases empathy and compassion for others and for yourself. And having that sense of compassion can be very useful when you're experiencing difficult thoughts and feelings. So what are the next steps? If you are liking what you hear about MBCT and it sounds like it might be useful to you, I have a class starting June 8th, provided it fills, 8 Tuesdays from 7 to 9 p.m., plus a half-day retreat Saturday, July 24th from 9 a.m. to 1 p.m. And if you want, anybody that wants to participate in that needs to schedule a free brief initial consult with me so that we can make sure that it's a good fit for you and that if you have any lingering questions that you want to have answered. You can also use, if that time doesn't work for you, we have a sign up form on the Midwest Alliance for Mindfulness website where you can indicate your interest and availability. And once we have a critical mass of people, then we send notification out and see if we can put a class together. Some other options is you can purchase the MBCT workbook and try to work through it on your own. I think that doing it as a part of a group is very useful. Most of my participants end up saying that was one of the most powerful parts of the experience is the group interaction that they have. And also you can go to mindfulnoggin.com. They offer some interactive online courses. And so they may have something that's more available for your schedule. I listed a bunch of different readings here that might be useful to you. The third one down that says the Mindful Way workbook, that's the workbook that you can work through on your own. And it can also be a nice accompaniment to the class. Full Catastrophe Living, the first one by Jon Kabat-Zinn, is a classic. It's a great one to read if you want to know more about mindfulness. And then The Mindful Way Through Depression, Freeing Yourself from Chronic Unhappiness. I really enjoyed that book. That was the book that was written based on their development of this course. And then just some books that I enjoyed that talk about mindfulness are Kabat-Zinn's Wherever You Go, There You Are, and Jonathan Haidt's The Happiness Hypothesis, Finding Modern Truth in Ancient Wisdom.